Welcome to Facebook Live. I'm Dr. Bill Bird, Chief Medical Officer at CGH Medical Center. Thanks for joining me today, and thanks for sharing this in the future. So I want to just tell you about what today's broadcast is going to look like. I'm going to give you an update on COVID and what's going on with COVID in the area. Not real long, but just a little something just to kind of give you some more information. And then we're actually then going to segue into a field trip. I went to cardiac rehab, and we're going to get a chance to highlight cardiac rehab. So we'll do that as soon as I'm done with a COVID update. So getting into the COVID update, let's make that segue. CGH, we have fully vaccinated 2,204 people as of the end of this week. And we have given at least 2,828 people at least one dose as of the end of this week. We right now are vaccinating patients mainly 65 plus, but depending upon how many of those have already had vaccines, we're beginning to dip into that 18 to 64-year-old category of folks who have some risk factors. So that's kind of where we're at as a hospital. In Illinois, what I'm hearing, what I'm reading, what I'm seeing, we are pretty doggone close to about anybody who wants to get a vaccine being able to get one. So I'm really happy about that. I don't think we're quite there, but we're really close. If you go to vaccinefinder.org or you go to one of the Illinois mass vaccination sites or even go to the health department sites, you're going to find more and more that the criteria to get a vaccine is less and less restrictive, and even to the point where it's just if you're over the age of 16, you're going to be able to get one. So that's really exciting. I think the thing that I would add with that is it still makes it really important to get a vaccine. And I know many of you who are watching are the folks who are going ahead and getting your vaccines as soon as you're able to do so, and that's great. I would encourage you to encourage those around you that you have influence over. If they're reluctant to get a vaccine or they don't realize that they can get one really soon, to really reach out to them and really encourage them to do that. Right now, we're kind of in this influx where we're seeing a bit of a surge here in this area. Matt's going to put up some information here on the screen that we can take a look at. In just a minute. There we go. Okay, so this is as of March 29th, what our numbers we're looking at. And I look at that top left, that positivity rate at 6.5%. We were, I think, below at one moment in time, like a month or so ago, we were around 1.5%, 2%, and now we're creeping back up. I think even yesterday we were at 7%. So if we keep creeping up with that, we're going to have. My concern would be we kind of get back into that mitigation phase again. And then I'm looking at my the thing here, and you'll see that red area. And let me get my glasses on so I can see this a little better. But you can see that the bottom right one, it shows that in the last 2 weeks, we've definitely had more cases in the 2 weeks prior to that. And I think now let's compare this, Matt, to where we were at sometime in November, though, just to get some sense of. We're having a bit of a surge here, but it's nothing like we were seeing in November. So you see in November 16th, the weekly update, we were at 25.7% positive rate. That was pretty wicked. And you can see the daily case count. And at that period of time, the 2 week, we had more than the 2 weeks, that 2 weeks and the 2 weeks prior. But what you'll see, the numbers are so much higher too, in terms of number of folks that had it. So I don't bring up those numbers recently to have folks, I don't mean to cause any fear or panic, but it's just the reality that some combination of, how we go about living our lives, some of our behaviors, along with the fact that the new variants, particularly that one from the UK, that is it's definitely more, it's easier to get sick and to catch COVID from that variant than from the old one that we had circulating through the area throughout most of this pandemic. And it's also easier to get sicker on that new UK variant. So some combination of that is causing these numbers to come up a bit. Thank goodness for the vaccines, because the vaccines help to pull those numbers down. And the good news on the vaccines continues to be that they seem to be almost 100% effective for all the variants so far in terms of keeping us from getting really sick. That really sick I define as having to be hospitalized or dying from COVID. So that's the really good news. So once again, I just encourage folks to reach out to those around them, and for yourselves to reach out and get vaccinated as soon as you possibly can. So if we can do those things, hopefully we can stabilize things in the next week or two. When I do Facebook Live, hopefully we'll have stabilized and be able to kind of keep from having to do further mitigation. So that's my COVID update for the week, and we'll catch up more information next week as it kind of comes available. So in just a minute, we're going to transition to, I went yesterday to cardiac rehab and did a field trip with the team there in cardiac rehab. I think you'll enjoy that. As always, we have some lighthearted moments during those field trips. It's a good opportunity for you to get to see the folks that work here at CGH and the good work that they do. One thing I was realizing after I did the field trip, though, we talk about where it's at in the video, but I want to be clear where it's, just so we weren't real specific. So cardiac rehab at CGH is actually in the lower level of the Lynn Boulevard Clinic building. And that Lynn Boulevard Clinic building is in Sterling, and it's really close to Kohl's, that Kohl's there in Sterling. So just some perspective of where that is at. What's Donna have to say? Yeah, that's a good question, Donna. I don't have any great answers. I really don't. The thing I guess what I tell our medical staff is, there are a certain group of people that you're just not going to get them convinced that that this vaccine is a good thing to take. And as much as that frustrates me, everyone's entitled to their opinion and beliefs. I guess the pocket of people that I really encourage our medical staff, and I encourage those of you who are listeners here to kind of take some time with, are those people that, they just like, I'm not sure, or I didn't know, I hear I have to wait till May. Folks that just have some questions but aren't set on not getting that vaccine. So yeah, to the extent you're able to, really appreciate that. We all have an opportunity in the areas that we influence to be part of that. Okay, so anyhow, cardiac rehab. Yeah, I just want to let you know where it's at. Otherwise, I'm going to tee this up. I hope you enjoy the field trip. Matt, let's kick and take a look at our cardiac rehab field trip for the day.
Welcome to our cardiac rehab field trip. I have a familiar face, or at least part of a face, with me here today. This is Renee Stack. Hi, Renee.
Hi, how are you?
I'm doing very well, thank you. So Renee oversees this cardiac rehab area, and if you remember, or maybe you do, maybe you don't, from previous conversations we've done with field trips, Renee also oversees the CCU, the upstairs in the hospital. So it's a little different animal than CCU, Renee.
Yes, this is way different. It's still the family of cardiology, but completely different than critical care.
Yeah. So I'm gonna, pretty soon here we're gonna pull in Lindsay and Pat, who run the ship around here, and I know, and we're gonna talk with them some. Mm-hmm. But tell me about this thing right behind us, Renee. What's this all about?
So cardiac rehab is a facility that we offer to our community, and we are cardiovascular rehab certified. This is certification for every 2 or 3 years, correct? And it is a huge reward. They have to do all of this requirements to send it out to get accredited for our rehab unit, and the girls have done that with their normal functions. So it is a huge win for our department.
Yeah. So I think I take from that if you come here, people are going to know what they're doing.
Absolutely.
That's a good thing, right?
Yeah, I absolutely love these girls. These girls are strong, and they take care of our patients, and that's our number one focus. And this just gives us background that they're doing the right thing for our community with cardiac rehab.
Great. Well, thanks, Renee. Good chatting with you. So we're going to let Renee go back to her normal home, and I'm gonna chat some with Lindsay and Pat. So thanks, Renee.
Thank you.
Okay, so I have with me Pat and Lindsay. So I'm going to let them kind of tell you about themselves. So hi, Pat.
Hi, Dr. Bird.
So Pat she's been at CGH for a while.
I've been at CGH for 40 years, but only been out here at cardiac rehab for the last 2 years.
Okay.
Prior to that, I was working in surgery. So
Okay. Yeah, you were in the OR for how many years?
38.
Okay, so it's basically been OR.
And then come out here to cardiac rehab.
Yeah.
And I also help out in cardio lab a little bit too. So
Yeah. And another fun fact, Pat is Employee of the Month this month. Is it? Yeah, it's still March, right?
Well, today,
Yeah,
yes,
so
thank you.
You have the honor of seeing the March Employee of the Month during March.
Thank you, thank you.
Now, one of the nice things about being Employee of the Month is you get this parking spot right by the back door. That doesn't work so well when you're out here, does it?
No, it doesn't. But if I have to go back to the hospital for anything, then I do definitely use that parking place because it's kind of nice.
Yeah,
So.
if I'm Employee of the Month, I want to be Employee of the Month during January or February or something like that. All right, and I have Lindsay. Hi, Lindsay.
Hi.
Now, are you a billboard person?
I was. Yes, I was.
I thought so.
Last summer.
All right, so if you were driving around and you saw some CGH people on billboards with these masks on,
I was showing off the mask.
Lindsay, how long have you worked here?
I've been at CGH for 10 years this year. I've been down at cardiac rehab for the last 7, so this is my home.
Where were you at before you did the cardiac rehab, Lindsay?
I came from the emergency room, which I still work there.
Yeah, I see you once in a
So,
while there. Yeah.
yep.
Okay.
I kind of play between both.
Okay. All right. Okay. So, you ladies ready for some questions?
Absolutely.
All right. I have them written down here, but I'm going to try to wing it and ask some of them by memory. I'm not the greatest memory, but okay. We started talking about the billboards, about the masking, and all that kind of stuff. So, with the pandemic still going on, how has that affected how you go about doing things and the ability even to do cardiac rehab? I'll start with you, Lindsay.
Well, it really hasn't affected us a lot, which is great because we clean the equipment after every patient. They wear their masks. I mean, they are able to take it down while they're exercising, but we have them put them back up. We socially distance. They all have their own chairs, their own blood pressure cuffs. So it's, COVID friendly very much.
Okay. And you have a lot of equipment here. I take it you have enough equipment and you can spread folks out enough that it really has it restricted your schedule in terms of how many people can come here?
No, it really hasn't restricted our schedule. And to be honest, we've been a little bit slow compared to what we've been, say, a year and a half ago as far as numbers of patients.
Yeah.
So it's definitely been easy to distance people, and they're very much aware. They don't want, this is typically an older population of patients, so they're concerned. They don't want to get COVID by coming down here. So they themselves are very conscientious and aware of where they're at and what equipment they're on. So it's great for them.
Yeah. I look out over the equipment, and even back behind us here, I see clean. And, so can you tell me about that, Lindsay?
Well, this is how we know which modalities have been used and we need to wipe down before another patient gets on it. So we're not putting patients on equipment if they haven't been cleaned yet. It's just a reminder for us.
Yeah, okay. Well, that's nice. Yeah, so it's just pretty clear about whether something's clean or dirty and that type of stuff too. So good. Okay, so who qualifies for cardiac rehab? How does a patient or their doctor decide that, this is somewhere where you need to go?
Well, they have to be referred by a physician, but there are certain qualifications to get you to cardiac rehab. Basically, any heart attack, stent placement, open heart surgery, valve surgery, even congestive heart failure patients within certain parameters, they can be referred to phase 2.
Okay, all right. So, and that's okay. Good segue. So, levels of cardiac rehab. You mentioned phase 2, Lindsay. So, first of all, you have to have a heart issue. that we've established that.
Right.
So tell me about these levels.
So phase 1 is typically, say if a patient has, say bypass surgery, phase 1 is what they're initially doing with them, getting them up and walking around in the hospital.
Okay.
Phase 2 is where we pick up, and it's monitored cardiac rehab. We put the patients on the monitor. We set them up with a prescribed plan of exercise.
Okay.
And watch their heart, monitor them. One of us is on the monitor at all times when they're exercising.
Okay.
And then phase 3, the third phase that we have, is where they can progress into that. They come out and exercise on their own. They do their own routine for working out.
Okay.
But we're here for them if they need us. if they want us to check their blood pressure, they're not on the monitor per se. But
Yeah.
and so we get people for phase 3 that have been coming for 15, 20 years.
Okay,
to
that's a
three.
long phase.
It's a long phase, but it's kind of like their security blanket. They know that we're here if they need us, but they've
Yeah.
had prior cardiac events in the past,
Yeah.
and they just want to continue to work out.
Yeah.
They know they feel better when they've been exercising
Sure.
and doing things. So
Okay, that makes sense. So for phase 2, I'm guessing one size doesn't fit all. How do you figure out when I show up and I've had a heart attack? How do you figure out what I need?
Great question. We get that a lot. Every patient on their first visit gets a thorough nurse assessment, which will include a basic baseline function test, kind of give us an idea of where they're at physically.
Yeah.
And then from there, each patient is progressed. They're started and progressed at their own level based off of that information, along with their diagnosis, their blood pressure, the heart rate monitors, readings, things like that.
Okay.
So they're all progressed individually. So it's very much individualized.
Okay. How long does phase 2 typically last for?
we go by sessions and not weeks.
Okay.
So typically you're looking at the bare minimum of 18 sessions. We do cardiac rehab 3 days a week. So people are worried, says, oh, I may have to miss a session. That's not going to affect them. Again, like I said, the sessions, and they can go up to 36 sessions. Typically, we have them anywhere from 18 to 24 sessions.
Okay.
We base everything on the first day, like when we do that assessment, like Lindsay was saying, we do a 6-minute walk with them.
Yeah.
And we look at that in addition to how are they able to walk around this room for 6
Yeah.
minutes? How many laps did they do? How far did they walk?
Yeah.
And the last day, when we think they're getting good, the parameters are looking good, their monitor looks good, blood pressures and everything, we do that 6-minute walk again to see how much they have regressed. And people are really surprised at how much they've changed, how much better they feel, and how much more they're able to do with the exercise.
Right. So we're talking, I'm doing the math on that as you're talking. That's about 6 to 8 weeks for most people to be in phase 2.
Mm-hmm.
Does phase 3 get paid for by the insurance companies, or is that one of those things where patients, how does that work?
Phase 2 is insurance billable. Phase 3 is not. So this is facilities used as like a Westwood or a Y. It's a pay out of pocket, but it's just $4 a session, so it's very doable.
Oh, wow. Okay.
And your sessions never expire, so it's
Yeah.
not like a reoccurring monthly fee.
Okay. All right. Are you guys kind of like Peloton instructors for phase 3? We're like
Exactly. We're
you-
better.
Okay. All right. All right. So, okay. Next, now I'm going to have to break out my list here. So,
Yeah.
okay. All right, my memory is beyond my memory here. All right. So, how much of cardiac rehab? I'll start with you on this one, Pat. How much of cardiac rehab is aerobic? In other words, you're doing like this treadmill versus like strength training, where you're doing some muscle building.
Initially, I almost all 100% is aerobic, I would
Okay.
say.
Okay.
There's 4 different areas that we start them out with, whether it be walking,
Yeah.
recumbent stepper, recumbent bike, and then an arm crank if they're able to use their arms.
Okay.
As they progress along, we do have weights and we start them with strength training. So at that point, you're probably 80-20% with aerobic and anaerobic, the strength training being further on down. They feel comfortable. It's giving them ideas of things that they can do at home because we want them to continue exercise at home
Yeah.
on their non-rehab days.
Okay.
Not completely just do anything
Yeah.
on those other days of the week.
Yeah.
But they don't realize. I personally didn't realize how much weights can help you out
Yeah.
with anaerobic exercise.
Right.
So we had an intern last fall that helped us set up a whole set of exercises with weights and without weights.
Yeah.
He took pictures, he did the whole thing, and it's been a great tool that we've used.
Okay.
We had the weights before, we did a little bit with it, but it really reinforced what they can do. And they see pictures on the wall back over there, we can show them to them later.
Yeah.
What they can do. And sometimes it's simple little things like standing up, holding a weight and getting up on your tippy toes.
Okay.
So
Yeah.
it helps them a lot.
Yeah, good. So Pat mentioned protocols and those type of things. So where do these come from? Is that part of this certification
It
thing?
is,
Lindsay?
correct. So as part of AACVPR, which is the American Association of Cardiovascular and Pulmonary Rehabilitation. So it's a nationally accredited. So we get all of our protocols are based off of all of their recommendations. So we kind of just go off of their,
Yeah.
and it's updated every few years. So we feel that we have the most current recommendations.
Yeah, good. Okay, yeah. So I'm gonna kind of transition to tell me from your perspectives, like some patient success stories. What would be your favorite patient success story? Obviously, you're not going to be giving me a name, but someone who came to cardiac rehab. Pat, you look like you're chomping at the bit to tell me something. Okay, let's hear it.
Okay, I really think there's so many, it's hard to hone in on one particular one, but I have one patient in particular. I did his admission, and in the office when I thought he was going to get up and walk out on me, I'll be honest.
Okay.
He didn't want to be here. His doctor was pushing him to do it.
Yeah.
Had some little warnings from the doctor, hey, don't say anything to him about his weight, don't talk about this, he knows what he needs to do. But I talked him into staying. He did a 6-minute walk, he continued to come, and as time progressed, he realized that he was able to do more. He had more energy. He wasn't as short of breath doing normal activities, whether it be here or at home.
Yeah.
And he continued on and got to the point he hated when he had to miss.
All right.
When he finally graduated with us, he was very interested and came back for phase 3. A lot of people are like, oh, I can do this at home. He wanted to come back for phase 3. And he realized that life is better by doing this.
Yeah.
So I guess that's my success story. Like I said, there's so many ones. You know, you go back and you're like, hey, their lipid panel came back great if you look at that later, or their blood pressures are in range now. So it's hard sometimes, like I said, to hone in on a particular one, but that one jumped out at me because I really thought that gentleman was going to get up and walk on me that day.
Yeah, that's a great
and he, he stuck with us for the full, I think it was like 20 sessions. So with the phase 2, and like I said, came back for phase 3.
Yeah.
So.
Great story. Great story. How about you, Lindsay? Can you top that one?
Not really, actually. But I do have to say, it's a very rewarding department. A lot of the patients are very thankful for just being here for them, helping them through, a hard time after surgery. So we're pretty proud of our program and the services that we can offer the community.
Yeah, I'm just curious, to Pat's point about someone who was kind of a little bit like, I'm not sure about this. What percentage of patients come in here and they're like that versus the ones that are like, okay, I can't wait to
It's a pretty big percentage, I'd say. I bet 80% of the patients don't want to do this.
Okay.
But then we suggest, and then, it just takes a little bit of explaining. They think they're going to come in here and have to run on the treadmill for 6 minutes or, do all this, hour-long workout, which it's not. It's very individualized. We start at where they can start. So, and once they know that, then they're willing to.
So that's one of the biggest hurdles, it
Exactly.
seems like, is their
Just explaining it.
preconceptions of
So
what it is that
this is a great video because I think a lot of people just don't know what it is. And, the education is a big thing.
Yeah,
So
good. Let me see what else I wanted to make sure does for the people listening, we had Dr. King on, one of our vascular surgeons, a few weeks ago, and we didn't get a chance to talk about it, but one of the things he treats are people that they don't have good blood flow down to the bottoms of their legs. It's called claudication, or intermittent claudication is the fancy medical name for that. Is that something that qualifies here, and do you have patients that come here with that?
We can do that. It's the peripheral artery disease process. Again, if the doctor fills out the order, sends the order to us, they can justify being able to come here because it's definitely, vascular is vascular.
Yeah.
So yes, it is one of the things that a lot of our stuff is based on what Medicare will pay, which Medicare pays 80% of a lot of these diagnoses. And then other insurance companies, follow suit. If Medicare pays, well, then we will pay.
Yeah.
And a little side note to that, we always recommend people tell them, check with your insurance. Make sure that they're going to cover this. Tell them this is monitored cardiac rehab. So,
Sure.
But they would do the PADs.
All right. So another question I just wanted to run by both of you is, like, if I had a heart attack and I don't know, if I were out of town or somewhere or another, I'm interested in doing this, do I need a doctor's referral to come here?
Yes, you do. But if your doctor doesn't contact, usually the doctor's office will contact us and then we will contact them. But if it's been a while and you're interested in cardiac rehab, give us a call. We'll find a way to get you in, whether your diagnosis fits in phase 2 or if you come in phase 3. So just give us a call and we'll help you get in for exercise.
Okay, full service. You heard that. All right, great. We're on the far end here, kind of cardiac rehab. Liz will kind of pan out over the area just to give folks a sense of.
Space that we have.
Yeah. So there's a lot of
machines.
So there's a lot of equipment here.
Yeah, we have 4 basic machines that we have a patient do every session that they come. A treadmill if they can, a stepper, a bike, and an arm ergometer, and then the weights, of course. And we have plenty of each machine, so nobody's ever waiting for equipment or anything like that.
You'd have to be just like over, there have to be
Yeah.
like a lot of people in here for this to feel like it's,
And we do keep the classes small, so we have very much one-on-one with each of our patients that come.
yeah, good. I see one thing I want to walk over towards, and that's the area where you have some pictures and the weights. Yeah, so Pat, tell me a little bit about this station.
So this station is with our weights and strength training. We had an intern last fall from Western. He was into sports medicine and exercise therapy.
Okay.
He went through as part of his senior project for his degree and set this up for us. And he took pictures, he explained them. We divided them into 3 groups. So if a patient wants to start doing weights, partway into their rehab, then we come over and we explain to them how, like for instance, they can pick, 1, 2, we've got all the weights, different size weights. And sometimes it's just a matter of maybe sitting and, raising the weights up above your head. We recommend that they do 10 reps of each one that they do. If they want to do just one set of exercises or do all of them, there's 18 exercises. But it's been great because people look at this and they go, hey, I can do this at home.
Right.
So they take it home with them, that concept. And then when we discharge, we have a flyer that shows some of these things of exercises that you can do at home, things that you don't think about, that you're still getting that workout in,
Right.
the anaerobic exercise.
Right.
And especially with diabetics, strength training is huge with their blood sugars and everything else to help keep things on the down low. So
control things.
everything, we all think aerobic exercise is great, which it is, but anaerobic is also good for patients.
This thing right here, tell me about this thing, Lindsay. Yeah, this is, it looks like a torture machine a little bit, but.
So this is the arm ergometer. It's very aerobic. This is probably the exercise or the equipment that they get their highest heart rate on usually. So basically we set the tension and they just crank the wheel for the allotted amount of time, and it's very aerobic.
Okay, yeah, I'll bet. You want to give it a try?
Sure. See, it's easy as can be.
Okay.
And then we set the timer and it just
And you
keeps
looks like
when
you
they're
looks like
finished.
you can have different tension
Yep,
levels.
you
and
change
that's
the
gonna-
tension. So
that's going to make a difference
increase
too.
it as they go. Correct.
Yeah, I could see that. It wouldn't take long. It seems like your upper body tends, like if you're doing that kind of stuff, it
Yeah,
tends
that
to fatigue
raises your
quicker
heart rate
than.
very high.
Yeah,
Yep,
yeah.
much more than
Yeah.
the lower body exercise.
Good.
So
Good. Well, I'm going to have you guys here again. So Pat and Lindsay, any parting words? Any words of wisdom, things you wanted to say for the folks who are watching?
I just say, don't be afraid. We've had patients over the last year with COVID be afraid to come down here to exercise, to go to rehab. Number one, don't be afraid. We follow precautions. We're very much aware of what's going on. We've put signs up about, we have hand sanitizer, we check temps, we wear a mask, we distance everybody. But cardiac rehab, it really helps you feel better. It's, after a cardiac event, you want to know that you can continue on. And even when they're done with us,
Yeah.
continuing on with what we call phase 3, whether it be on your own at home or down here with us, exercise is important and it's for a good quality of life. So
yeah.
you don't want to work hard to get to a certain point and then give up on it. So
Yeah, for sure. Anything else from you, Lindsay?
I think the hardest part of getting into exercise is actually getting here. So if you're interested, give us a call. We'll get you here. And then the rest is easy from there. We're very proud of our program. So
Yeah. These gals do a great job. And if you get here, they're going to get you moving and get you
I'm
more.
going to push you a little bit.
Yeah, get you more functional in terms of what you're able to do. So, hey, thanks again.
Thank you.
Great doing our field trip.
for having us.
Yeah,
Yes, thank you.
All right.